welcome onto the Nutrition Spot. This is Bethan TV. We appreciate you for being our constant viewer of Bethan TV. And tonight on the Nutrition Spot, we want to look at something that is really triggered our minds as the healthcare professionals, and we want to look at the health-seeking behavior of people in the different communities and even of the health workers themselves. I once again want to appreciate each one of you for making it a point to watch Bethan TV. So we are live on our different social medias, that is on Facebook, our YouTube, and on our website as www.bethantv.ug. My name is Giftina Kayinga. Today, if you want to be a part of our discussion tonight, the number is going to be running over your screen. So if you have any questions, prepare your questions in advance, or you can also type them on our WhatsApp. The number is 0785050762. We shall be able to get to know what you want to speak to us or to ask our experts. In the studio today, it's quite different because we do not have a nutritionist, but we have our doctor. We do have a medical doctor and a private proprietor of Care Medical Center is called Dr. James Haimbisiwe. We're going to look at health-seeking behavior. So before we go into the details of our topic of discussion tonight, I want to welcome our guest in the studio to wish us a happy new year to all the viewers and also welcome us on board onto our today's show. You're so much welcome, Doctor.
Thank you, Madam Nakayenga. Thank you, viewers. Good evening to you. And I'm glad to the management of this TV, Bethany TV, for being here so that I can also offer a service to my community. Happy New Year to you all, viewers.
Thank you so much. I like it when you say that you also offer a service to the community. Actually, we're here to offer a service. If you've been watching Bethan TV for the past 1 year, we are specializing in health. So we thought that before we get into the year, we want to encourage you to cultivate health-seeking behavior that is really good. So you can look into yourself and ask, when is the last time I actually went into the hospital for a checkup? When is the last time I checked my blood pressure? When is the last time I did this and that and that? When is the last time I checked my HIV status? When is the last time I checked my, oral cavity and everything? So betugenda okwogerako olunaku lwa leero twagala okubajjukiza nti kya mugaso nnyo okukozesa abasawo betulina mu ggwanga wano Uganda nga tonnagenda bweru kuba ne mu Uganda tubalina wano. So today I'm going to go back to our guest in the studio to just make us understand if we say health-seeking behavior. Why health-seeking behavior?
In fact, our dear viewers, I want to put this clear. It's supposed to be health-seeking characters.
Not even
we are
behavior.
Forgetting, when we talk about behavior, it looks to be like it's a misgone. But this is supposed to be a right way. Just like how we prepare ourselves at the beginning of a year. Parents are preparing school fees. Kids are preparing to set and go back to school. We should also be preparing to know how we are going to go through these channels of health seeking. There are so many challenges that we have met alongside, but in real sense, we don't see it being a killing character within our society. We have left diseases to advance from a primary stage to a tertiary stage, and at the end of the day, we look for primary healthcare services instead of seeking for a tertiary healthcare services. Wow. So in this evening, that's why I'm here. And I'm a representative to this, to inform the society, the community, that this is the right time to include this within our menus.
Within
our menus, our arrangements. That as we plan to feed our bodies, we should also plan to visit our health workers to get more informed about our health side as well.
So if you said, and then you talked about the primary and then tertiary. So take us through the different phases of the care or the treatment.
In most cases, when we look at definitely the challenges and how we get infected or we get health challenges, it will either be through infections or through acquired or acquired challenges that we get within our lives, or some of the conditions develop according to the environment or to the genetics within our family genetic arrangement. So at the end of the day, what we are trying to say is you need to listen to your body first of all and get the warnings. Before the warnings, why don't you save some time and visit a health worker?
Okay.
To me, I should say on an individual basis, at least secure 4 times, at least 4 times. If you're really healthy and you're following, guidelines from your health worker, at least think about more than 4 times a year when you are not sick, but you're going to a doctor and making inquiries about your life and talking to your doctor, and your doctor will definitely, doctors or health workers have, investigations and physical examinations that are meant to carry on you and give you an information about your health.
But doctor, you well know that in Africa, or let me say in Uganda, tutera nnyo okugamba nti mpaka nga mpulidde nti kyetaagisa, mpaka ng'ogwo omutwe gunnumye ne gulemerako nnyo, mpaka ng'olwo olubuto lukoze buti, mpaka nga ndabye kino wenyinza okugenda mu ddwaliro. So why are you encouraging us now to develop a character of seeking help before it's too late?
Seeking to be checked before you get ill is supposed to be a habit, and a habit to be followed on an individual basis. Why? Because at the beginning I informed our dear viewers that at the end of the day, a health worker knows what to check in order to inform you or give you a warning that this is going wrong. There are so many physiological challenges that we meet alongside as we grow from age to age. First of all, there are so many conditions that we always meet as we grow older, as the year changes, just like recently we had 2023 and now so far it's 2024. So you did not remain the same on your body. So many people do change weight. On average, every month, people come from a different, status of weight to another status of weight. So at the end of the day, there are so many physiological challenges that are taking place within your life that you need to be checked and be informed, so that a health worker can give you a warning. If, let's say, you're becoming overweight, we'll even inform you at least, you know what, this weight may cause an issue or an uncommunicable disease may start setting.
Because of the weight.
Because of the weight. You may need regularly to be checked according to your blood pressure, preferably, because blood pressure has always changed according to the conditions that you're in. So that's what the things that I'm trying to warn people, so that the health worker can inform you when and what to do, so that you can avoid these diseases. And at the end of the day, even when you have a disease, you need regularly to be checked.
Even when you have a disease?
Yes. You need always to be checked so that the health worker can guide you when to take the drugs and when to stop taking the drugs.
Well, maybe to us that may not understand why we do not actually walk into those hospitals to seek help, to maybe to do checkups and all that, what could be the factors that have been a hindrance for people seeking health care?
There are quite a number of factors, and many of them, I should say, rotate within our normal schedules. And our normal schedules, we always look at health as a by the way. We don't put health as the priority within our lives. So the first thing to do on an individual basis, at a family basis, at an organizational basis, is to put health as number one. And sometimes I wonder, even I ask myself, why should an employer think of acquiring an employee before a medical checkup certification? Now, having known this, then that's where we are going to give reasons, and quite a number of reasons, including definitely, understanding ourselves very well. But before understanding ourselves, we should first know why should we go to the health workers? Right. So why should we go to the health workers? Why shouldn't we go to the health workers? Most people within our communities feel, kind of, they get, I should say, low esteem. Feel like, why should I go to the health worker? What if I go there and the health worker tells me I'm sick?
Yeah, because they tell them
exactly. Most of us, on an individual basis, we feel we don't want to hear about ourselves, health-wise, we fear to know about ourselves. Secondly, most people feel the budget is not fitting to include fees on the health, to fund for health. That is the major issue. But I want to inform most people, so far in Uganda, there are so many, health services that are given at free basis that you don't need, first of all, to pay a health worker to check you, including weight taking, including blood pressure taking, including, let's say, to the females, screening for cancers, all those things. There are so many that you don't need, first of all, to know, to save a lot of money in order to go and meet a doctor or a nurse. So by doing so, you'll have prevented a lot of conditions that would have preferably advanced into a tertiary stage. Most of the diseases, not only cancers, most of the diseases, non-communicable diseases, once they advance into tertiary stages, they are quite hard to manage. There are so many conditions where a patient, is ushered to a hospital and health work team looks at this patient and the mind goes off. They don't really get where to begin from by doing investigations. You get it? So that's what we are trying to inform the public, to say, please, hey, include this on your menu, include this within your family, include this within your organization. Inform your health workers, inform your employees, inform your family members and say, hey, please, at least, these days so far we have so many, this is the time when our holidays are still going on, and I wonder why, as parents, we still have our children at home before, leading them into health workers, outlets, into hospitals for checkups.
And I think now, if you're talking about the parents, I think parents also should, I don't know what I can say, abamba ino kubera serious, because a parent can come into the hospital, ngesomero limuwadde form gye balina okujuza entuufu, but they want to bypass protocol. So what do you have to say about parents that do that want to bypass particular tests, because for them they think they are not important?
First of all, we should admit that most of these systems have promoters, and the first promoting agent here is the school or the college where these students are heading to. Most of these schools, we should admit, they have received these students not even bothering to read notice on these medical forms. So before, above everything that we are thinking about, we should also admit that, or I should inform the public and even the colleges and the schools that most of these forms are filled by the parents themselves. And those who are not even health workers, they are the ones feeding this information into it. So what we are trying to say is, as you're planning to take this student of yours, your kid, back to school, think about two issues. Are you taking a patient to the school, or you're taking a student who's going to ingest whatever they are going to be teaching within the school itself? So what we are trying to avoid here is taking patients to school.
Because they are taking students, you're taking patients.
We are taking patients. So once you accept, you admit that you filled this form yourself as a parent, or when you yourself as a parent, you went with your medical form from the school and helped a nurse or a health worker to write on this form before examining the student or doing investigations on the student, kindly accept that you are promoting patients within the school themselves. Now what next is within the first week of arrival at school, having the whole students ill. And definitely programs at school will be interrupted. What I'm trying to say is, I'm just assuming there's quite various, infections within our communities. Infectious diseases are real. Yes. Whether they are UTIs, whether they are gastric related, they are real. So now you have received a patient who's having an infectious disease. Within the first 2 weeks, it's enough to have the whole school of 1,000 students down here. And definitely, as a school, you end up giving, pass outs, and then the program of the school will be interrupted. So what we are trying to say is, as a school, it cannot stop from having a dispenser at school. It should also be advanced that you should also have a hospital that is giving you a backup so that they can make these checkups of these students.
The hospital that is attached to the school.
To the school, yes.
Because we're looking out for authentic results from the hospital.
Definitely, yes. To formalize the medical checkups within the school itself.
Thank you so much. Now talk about the school. We have Excel Junior School. It is a child given good foundation. If you're looking for a school that is having a very good foundation for your child and where you're going to have your child checked so well medically to ensure that they do not have any disorders or any abnormalities that are going to affect them while they are studying, it's Excel Junior School for you from Zante Town in Deje. So if you're a parent and you've not yet decided where to take your child, kindly consider to take your child to Excel Junior School. They have classes from nursery to primary 7, and they also offer trained programs from trained teachers, and also they make it a point that your child eats so well. Remember, this is the nutrition spot, and for us as Bethan TV, we encourage people to eat so well, because through eating well, you can transform your life. You can curb a lot of conditions, diseases, and disorders. So Excel Junior School ensures that your child, while they are at school, they are feeding so well. The environment is so good. So as a parent, you would want to have your child have a holistic environment while they are studying. This is still the nutrition spot. We're looking at a health-seeking behavior. Omwaka nga gutandika wagenzeko mu ddwaliro ne weekebeza bw'oba tonnagendako mu ddwaliro, irrespective of the gender, irrespective of the age, oba oli mukulu oba oli muvubuka, we encourage each one of us to go to the hospital. With our expert in the studio, Dr. James Aimbisi, we're still emphasizing the need as to why we have to go to the hospital. At this point of time, we're going to zero down to breaking down the different checkups that osobola okutandikirako nti after the show. Tomorrow is a Friday. Osobola okuzuukuka n'ogenda ku ddwaliro lyonna erikuli okumpi n'ogamba abasawo njagala kebera kino na kino na kino na kino. So doctor, back to you. Can you make us a list of tests omuntu enkyaza asobola okukeera n'agamba nti naye kati kangende nkebere kino na kino na kino na kino?
We should first of all accept, just like how lawyers and other service providers are.
We should do it?
Just like how lawyers and other service providers are, we should first of all accept that we should admit and give chances to the health experts. Preferably, talk to us and define what is necessary to be checked on our body.
So for them, they can do the talking.
They can do the talking.
Then you do the confirmatory tests.
Exactly, that's what I'm trying to say. So by all means, at least starting from tomorrow, make sure your family members are checked, and even you yourself, you're checked.
Why would you say family members are checked?
No,
I think you've emphasized family
so much. Yes, and
because organizations, but let's start with family. Why family?
Because there are quite a number of individuals and with their different age groups within our families. Daddy, mommy in their 40s and above, students who are at home so far within this teens, 8, 9, they have different categories of checks that the health workers will always define important to them. So that's why I'm trying to not talk direct to the families. What I'm trying to say is, you may not instruct your health worker and say, I'm here to check for malaria, I'm here to check for HIV or hepatitis B. kindly visit your doctor, visit your health worker. Make use of your health workers within your life.
So they should visit and not go anyway. I get it now, because you want also to discourage the self-diagnosis. So if someone looks in the hospital and they're like, I want to check for this, it's as if they're having
more of
an
a self-diagnosis, self-prescription.
Thank you so much.
At the end of the day, there are so many warnings that always come, to our lives, and always, bluntly put them down.
Okay.
Mostly when these warnings always come as signals for us to be informed that this is the right time when you are supposed to visit your doctor.
Thank you, doctor. From there, us knowing the right time as when we are supposed to visit the doctor, we're going to get into a break. After a commercial break, we shall come back and give more details on why it is important for you to do our medical checkups from a professional medical worker. Welcome back from the break. I would say that empowerment begins when you make the decision to actively seek the best health care that is good for you. And also, I would say that your body is a temple. How would you want to treat your temple? Would you want to just, look at it just anyhow without taking care of it? You would want to take care of it, but you cannot give the whole care that it needs, but you can get the whole care that it needs by going into the hospital. So today on the Nutrition Spot, we're emphasizing health-seeking characters. We've been told by an expert that they're not even behaviors, they are characters. And remember, if you were with us when we were starting the show, I said that some of the things you can ask God to help you work on is your character, your mindset, and your personality. Now, if we're looking at the health-seeking character, that means character is everywhere. So in the studios, we have Dr. Aimbisiwe James from Care Medical Center. We still are looking at the recommendations for the medical checkups that can be asked by the medics, by the doctors. It's not advised for you to go into a health center or a health facility and then you tell them that I need to check this and this and that. Just give your concerns and then the doctor will direct on you the different tests that you're supposed to undergo. So back to you, doctor, the recommendations that we should look out for from the medics.
First of all, most of the recommendations that medics will always look at, like Arya said, always differ according to your size, age, and physical looking.
Okay.
They differ a lot. So most of the general recommendations always come from preferably the patient's complaint. These are totally common. And most of those, patients' complaints, and most common complaints, you always talk about what they feel, their symptoms they feel. Say, doctor, I'm feeling headache. Some people come feeling dizzy. Some people come having fevers for some 2-3 days. Mm-hmm. And these fevers, by the way, they are quite technical. A patient will tell you, I'm feeling cold, but a health worker will test you with thermometers and will tell you you're hot. So once you feel any low temperatures within your body, know it that you're hot already. So you need, those are also warning signs that you need to visit a health worker. Most people feel headaches. Some always report with abdominal pains. Sometimes some even show up with history of vomiting, with history of running stomachs. There are quite a number of them, including itching skin. Some will tell you, some have been feeling itchy skin. Some will come with even skin lesions physically, you can see them. Some will report with tearing eyes, challenges with pain in the eyes and ears. There are quite a number of them. So most of these presentations, as clients may come alleging to be having, gives a hint on a health worker to start from.
But if someone comes and They're not presenting with anything.
They are not presenting with anything.
They've just walked into the facility and they're like, I just want to know how my body is.
And I want to say, if today is 10
Thursday?
days past within a month, if at all this year from the time it's began up to now, you haven't visited any health worker, take it from me, you are a patient and you need to be a hospital. You need to be in the hospital.
So
to
whoever
avoid
has not
this-
yet visited the hospital, they are patients.
The year has so far begun, you need first of all to begin with knowing about your health.
Kati bali eyo bakayana.
You need first of all to know about your health. And knowing about your health is not about Google, it's about visiting your health worker. So most of the checkups that always found, normal to be done when we receive the client that is not complaining or is not talking about any challenges that this is going through, we always do, first of all, weighing the patient. You get to know, you relate the weight you have with your age and the height. So we measure your weight, we measure your height to know very well about your BMI, body mass index, whether it may be a classification to an upcoming disease.
Okay.
Because most of the non-communicable diseases always rely on that. And also we always check for, blood pressure. You are supposed to be checked for blood sugars. We always, do urine testing, screenings. And because of our rampancy of infections, of acquiring this infection within the area, that's why we have to do the urinalysis and also do, malaria checks and also typhoid checks. Because seriously, we need to acknowledge that these diseases we live with them because of the habits and the habitats that we always have within our communities. So most of those checks always lie within those tests. But always a health worker may advance into physical examinations on you. And these medical physical examinations may as well be a signal to include other investigations.
Oh,
yes, like ultrasound scans, radiology screens, like ultrasound scans, like x-rays, in accordance to how the health worker has found your body on examining you. So those are also important as well. Yes, and at the end of the day, all these screens are done and the doctor or health worker will tell you, you know what, I think you need to be, done this, you need to be done this, you need to start on these drugs for prevention. Or you're already a patient, we have found you a patient. There are so many patients, there are so many, individuals always knocking to our doors as health workers and leave the hospital or clinics when they are patients already. But they came while not knowing anything about this. Mostly pressure, high blood pressures and all that. These days we should always accept that we hate water. We hate something called water. Liquid and colored liquid. But in real sense, most of those colored liquids are always cause, they always work as primary, triggers. They always trigger to most of those medical conditions that always, a challenge within our lives. So those are one of those few, investigations that always look at and then communicate to the client and also help. Without forgetting that most of those communicable diseases, whatever we may talk of, at least 60% of them come because we less use our bodies.
And so 60% of them come
because we less use
our bodies.
So whatever workplace you are or whatever works you do, always remember that exercise is part of the prevention of most of those non-infectious diseases, including cardiovascular, heart diseases, including diabetic, including all those diseases that always follow as a result of high volumes of fats within our body.
Wow. Yes. So, Doctor, before we go into something else, you mentioned and then you said that for some patients they use the internet because it's a Google. Nateka munti they don't pulira omutwe kati njagala kumanya kiki bwe mba mpulira omutwe kiki ekiba kiguleese. So is it a good thing for us to go ahead and consult the internet about how we feel in our bodies and what we see on our bodies, or it could be very crucial to whatever it is to just take it to the hospital? So what do you have to say about the internet?
Maybe about internet that I may recommend is these days we need to acknowledge that technology has taken over.
True.
There are so many apps in terms of telemedicine that are on ground. Instead of visiting Google, then find an app that you
Instead
can
of using Google?
Yes, that you can consult a doctor direct online.
Online?
Yes,
okay.
That's the best way. Because a doctor will be talking to you online, either by messaging or by audio. And you tell a doctor, visibly, you tell a doctor all your challenges, and then the doctor will guide you on what to do next, and then what will be a recommendation to your challenge. Let us leave Google alone. At least we can go to Google for knowledge acquiring, but not about our health.
Okay,
Because
for any other thing.
How will the Google now, do physical examination on you?
Like
at
how?
the end of the day?
I'm also asking, how really?
There's no way how preferably Google is going to help you. What you need to do is maybe you may acquire an app where you will meet doctors and inquire about your health, or visit a nearby health worker that is going to help you. Let us really put this on our normal schedules, on our normal menus in our homes.
Seeking health
Very well.
care.
It prevents a lot. It prevents a lot. We have seen our relatives, we have seen our friends going, unnoticed. And at the end of the day, the doctors will tell you, postmortem came out and said, this patient had a cardiovascular challenge, had a heart block, had stroke. And then someone will say, now how comes? We didn't know. So at the end of the day, we should say you did not seek for help when you needed help.
And I think in this era and age, we should say that ignorance is not an excuse, yeah? If you do not want to pay for the knowledge, like okusasula ogenda mu ddwaliro doctor okubuulira engeri gy'olina okuyisaamu obulamu bwo health-wise, yeah? Ojja kusasulira obutamanya, and you have to pay a lot of money eyobutamanya. So it's important to just pay little money and acquire the knowledge than paying a lot of money for the ignorance. And still I would say that you prioritizing your well-being is not just a luxury, but it is a fundamental responsibility. Bw'oyagala okulaba omuntu gwe tugamba nti wavunaanyizibwa mulabe ku ngeri gy'alimu obulamu bwe health-wise. This is the Nutrition Spot. If you have any questions, the number is going to be running over the screen. That is 0786050762. I'll repeat, 0785050762. You can call in and ask any questions, as our expert is still in the studio, but we emphasize nothing but health. We want to see a better community, people living well, yeah, without not any conditions, not even in schools, not even in anywhere. So, and we believe we can all achieve that using a holistic approach, but frequenting checkups into the hospital. But now if we talk about the checkups and the health-seeking character and all that, should we say that it's different from people that are living within the urban setting and those that are in the rural setting? Abomukyalo bajja kugamba ffe tuyina hubs zaffe ffe tukola kino national ab'omukibuga abaana banatugamba ki, but could it be the same or it's differing? And if it is differing, omuntu ali mu kyalo, maybe we usually say hard to reach areas, how best can they also have that kind of character of seeking health, medical help, and also to someone that is into the health urban setting?
I want to say, so far Uganda, where it has reached, we don't have the village or rural or urban. It's almost
we don't,
rural and urban is in one.
We have hard to reach.
And for the purposes of health seeking, I'm sure even the health centers so far, they are well allocated within our villages, and those health workers are there. What I'm trying to say is, let us not really blame ourselves, and at the end of the day, we formed the grounds for the blames. What am I trying to say? We should acknowledge that complementary medicine is there to help where health workers are or cannot reach, or they were not available at that time. But since we have these health workers rampant everywhere, why don't we use them?
Some of them are just a phone call away.
We have quite a number of them, Mururuza, Kazires, whatever. There are so many everywhere. And I'm not condemning about them. Yeah. But we are trying to say is, you should also know that most of these complementary medicines, they have caused a lot of harm on our lives, in that they are totally non-regulated. You can't know whether you're going to take a full jerrycan or 1 liter to help your fever go. And at the end of the day, each and every herb that you have ingested into your body has got to go through a lot of mechanisms of action. That through these mechanisms of action within your body may lead into, it may endanger your kidneys or liver, which may be as well, a challenge for you to come out of it. And you may not, by the way, you may not get any help from the herbs to heal your kidneys or liver that was preferably damaged by them. So what I'm trying to say is,
Doctor,
take your herbs regulated.
Okay, the caller is gone, but if you want to call in and ask any questions or compliment on anything, the number is over the screen. Reduce the volume of the TV and then be able to call us 0786050762. You can call or you can send us a message on WhatsApp. We shall be able to read it. But we are live on our different social medias, that is on Facebook as Bethan TV Uganda and also on YouTube as Bethan TV Uganda. You can also check us out on our website as www.bethantv.ug. Those that are watching us on our different social media platforms, that is your TV app and Airtel app, make it a point to copy the number and also call. We shall be able to pick you from the studio. We're still looking at the health-seeking behavior, and I'm saying that practicing health-seeking is a cornerstone of you having a vibrant life. So, and we're encouraging a healthier lifestyle. So back to you, Doctor. You were still telling us about people that use complementary medicine.
Unregulated complementary medicine.
Complementary medicine.
And yes, complementary medicine. So at the end of the day, you have taken your herb and regulated it because there's no volume that you are supposed to be taking. There are no good measurements that we are supposed to take to heal your fever, let's say, or your diarrhea, whatever the symptom you are taking these herbs for. But always have this in check, that they may harm major organs within your body. And these organs may not have a good or a simple repair back to normal. So that's why I'm trying to say, at least try to take regulated complementary herbs or medicine.
Okay.
And then make use of your health worker. Irrespective of taking these complementary medicines, at least secure some time, visit your health worker for checkups and see how your body is. Going there for renal function tests, kidney function tests, it's not bad. Liver function tests, it's not bad. We have quite a number of even mamas and papas that they have adamantly failed to go to visit the, fertility centers to understand their fertility, statuses. And at the end of the day, they will tell you, I've been on herbs for over 7 years. And up to now, we don't have anything checking up. So let us not blame any ground, let us blame ourselves. Instead of blaming ourselves and let these challenges grow from primary to tertiary, let us visit our health workers. Make our health workers use within our lives.
So we should make our health workers useful in our lives. But how can we also have the healthcare providers effectively promote preventive care? Maybe I should first pick this caller. Hello.
Hello.
Manyago na wajo sinzi dokuba.
Ono Kasivante Dennis.
Kasivante?
Dennis.
Oh, nice to hear from you, Dennis. Any questions for our expert?
Expert mbadde mubuuza nti ate bano abali ku bya habo bano abatunda habo drugs habo medicine nga batunda bikaziire ebyo bakoze batya? Is it doses zaabwe zibeera regulated oba nedda?
Abatunda herbals.
Nga herbals otera okusanga emasanafu mu bifo weebityo.
Okay. Okay, Doctor. Kakuddemu nga tonagenda. Doctor. Okay.
Yes, okay. When we are categorizing health workers, we are talking about trained and skilled health workers, licensed health workers. So we are not including complementary medicine promoters.
So abakazi, they are here what and all those things.
Abo si basawo batendeke. Tumukogera ku basawo batendeke. Wegenda mu ddwaliro gy'ogenda okulaba mu licensing ewanise ate n'omusawo oyo ng'oli sure nti yabisoma. Agenda kuyamba checking alabe in accordance to our Ugandan clinical guidelines. Agenda kukola ekisoboka okulaba nti akuyambye. So herbal medicines, I'm not saying they are not bad. No, they are good, but to some extent they cannot heal. You need a health worker to guide you, to give you guidance on your health. Yes.
Okay. Thank you so much, Dr. Kasibante Dennis. Let me hope your question has been answered. If there is any other question, kindly make us know. We shall be able to get back to you. But you're still watching the Nutrition Spot. My name is Giftina Kainga with Dr. James Aimbisiwe, and we're looking at the health-seeking character of the different individuals in our different communities. Before we got in the caller, we wanted to understand how can the healthcare providers effectively promote preventive medicine.
First of all, I'm one of the examples in front of you, our viewers. Yensonga lwaki nzize mu maaso gammwe okubabuulira kiki n'okukolebwa n'engeri gye kisobola kukolebwamu. Eno eddoboozi ly'eno mu kuyisaawo si ddoboozi lya bulijjo nti oba music beats nti abantu balina okulizina. As we talk, there are so many families that are, I should say, overwhelmed with the challenges in their homes.
Health challenges?
Yes. Omwana erinnya limuluma, mami omutwe gumuli bubi, papa akamunguluze kamutwala, you know, and they are still seated behind thinking the other herbs are going to do the work.
So literally family yonna ndwadde.
Tukirize tukozese abasawo baffe mu bulamu bwaffe okulaba abasawo okubeera b'omugaso okutugaidinga obulamu bwaffe okutambula bulungi. That's what I'm trying to emphasize. So let us increase on visiting health workers, just like how we normally flock into our churches, into our friends' homes, those who parties and clubs and outings. Let us also flock into hospitals that are available within our communities. That's my grand appeal. And at the end of the day, we are going there because we want to learn how to take care of our lives. We want to be informed how our lives are so that we can be helped to know what to do next so that we can at least let these sufferings go down.
Thank you so much. And I believe that at this era and age, we have a lot of many actually not even a lot, many health workers almost everywhere. Nti buli ddwaliro ojja kusangamu omusawo, buli district mulimu omusawo, na buli kukyala actually ekizibu kati okusanga ekyalo nga tekiriko omusawo. So let us maybe befriend them. Let us do whatever we can do to make sure that we get the right medical attention or medical care that is needed for our bodies. Lastly, as we wind up the show, we have challenges of stigma that for some people, if they do come out and they're like, I have this particular condition, they find a lot of stigma in the communities. So they also withdraw from going ahead to seek medical attention. So doctor, as you do a wrap up, how would you advise the community on those individuals that feel like they are stigmatized?
First of all, I should say stigma is really, you know, on an individual basis, it's a real challenge. And the only information I should give to the public is health workers are trained. They know how to deal with such challenges. Secondly, as public, on an individual basis, please have some trust to the health workers. They are always trained. They know how to keep confidentials of their patients. They will not definitely, you know, take all this information to the public and the rest of the people. Not at all. We have the guidelines, we have ethics that we follow to keep confidentials of our clients, you know, firm, that they are not leaking. Yes, that's what I should say. So let them really gain confidence in us as health workers and have, a feeling that we are also human beings. We cannot take this to the public.
Thank you so much, Doctor. I think if you're out there and would still want to understand more about health-seeking character, I would encourage you to look for Dr. James. Yeah, he will be able to take you through and on how best you can improve on your health-seeking character. My name is Gift Nakaing on the Nutrition Spot every single Thursday from 8 to 9 p.m. So see you next Thursday, same time on the same station. Have the best of your night and Happy New Year to you once again.